You're watching UNICEF television. The UN Commission on Life-Saving Commodities for Women and Children convened in New York this week to finalize recommendations for urgent action to help women and children around the world. Launched by UN Secretary-General Ban Ki-moon in 2010 and co-chaired by Prime Minister Jens Stoltenberg of Norway and President Goodluck Jonathan of Nigeria, Every Woman, Every Child seeks to improve access to affordable and effective medicines and health supplies for the world's most vulnerable people. Every day, nearly 800 women die from complications during pregnancy and childbirth. And every year, almost 1.4 million children die from pneumonia. The Commission's work focuses on 13 life-saving commodities, which all too often do not reach the women and children who need them most. Among these are common commodities like antibiotics to treat pneumonia, zinc and oral rehydration salts to treat diarrhea, and oxytocin to stop mothers bleeding after childbirth.
We know that it is actually easy to reduce the number of deaths because by providing more medicines, which we already have, to more people, we can save the lives of millions of children and women all over the world.
During the Commission's session, UN Secretary-General Ban Ki-moon reminded the commissioners of the grim realities they are faced with.
Every day, 800 women and more than 20,000 children die from preventable causes. Every 2 minutes, a woman dies at what should have been a joyful moment. And millions of women are unable to choose if, when, and how many children they should have because they lack to modern ways of contraception. This tells me we are still not doing enough.
UNICEF Executive Director Anthony Lake, who also serves as Vice Chair of the Commission, makes it clear.
This is an opportunity we cannot waste. We must find new ways of overcoming persistent barriers. New ways of putting more life-saving interventions in the hands of more health workers to reach the women and the children in greatest need.
To that end, the Commission has been focusing on the three main areas of market shaping, regulatory environment, and best practices and innovation to help shape the best way forward.
We have these very simple, highly effective products that cost, in many cases, less than 50 cents, less than a cup of coffee, and can save the lives of hundreds of thousands of children and mothers, and we're not getting them out to those in need. So what we set out to do as our group is to first and foremost mobilize the attention of national and global leaders to pursue the relatively basic solutions, fixing the distribution systems to get the medicines to children and mothers, building the awareness and the education of health providers to effectively provide them, and then building the awareness of the mothers themselves.
Based on this week's meeting, the Commission will present their final recommendations later this year, in hopes to not only tackle treatable diseases, but prevent 33 million unwanted pregnancies, protect 120 million children from pneumonia, and ultimately help save a total of 16 million lives. This is Anja Baron reporting for UNICEF Television. For more information, visit unicef.org. Unite for Children.